And to go back to the E. coli breakout in the spinach, that was one farm in California, but it spread to 28 different states in the United States. And that's just one farm. And it took a while to find that. As well as physical health goes, does anyone have a guess how much land is actually used in the United States for fruit and vegetables?
Very small percentage.
It's 4% of our actual farm land, while our commodity crops are 74% of our land, agricultural land use in the United States. So what's happening is even if we wanted people to eat their daily recommended value of fruits and vegetables in the United States, we're not producing it. There's just not enough. So we'd have to have a drastic change in our food system if we want to make that happen.
Do you know the numbers for California?
Well, we produce 50% of the country's produce. So because of our climate, because of our current economy and supplies, it's quite different. I don't know which percentile. Oh, sure.
You mentioned about the coli breakout that was in California that was related to the animal feeding. Does it make sense for us to have those facilities so close together where we have animals so close to, for example, spinach, growing facilities?
I think in a different food system environment it does. In our current one, if it's more industrialized, we don't necessarily want the waste disposal near your grains or your vegetables. But in a local food system, I don't know a lot about biodynamics, but where the whole environment works together, it's absolutely ideal. Right. Is that one food production resource feeds into the other, but it's maintained in a healthy way to maintain soil balance and nutrient balance as well.
But it got into the water supply that was central, and it could spread to all of the growing things downstream from that water supply.
But a lot of that's because it's not being properly disposed of, and because they have more sewage than they actually can handle or deal with. So if they were actually using or disposing of that waste in a proper way, that wouldn't necessarily happen. I think the whole CAPO model itself is something that needs to change, and a lot of legislators are really taking a look at it, but unfortunately there just hasn't been a lot of action to date on really trying to shut them down or change them in the United States. Environmental health is something that we also are looking at. We know that greenhouse gas emissions, about 30% come from agriculture and meat production in the United States. Again, the issues of water runoff, which I won't really get into because we kind of heard through some of the other points that I've talked about. Land use. The whole idea of monoculture cropping, or really growing one crop on one land in mass production, easily depletes the resources that are in our land. They also make it more plausible for disease and can really take out an entire crop. The synthetic fertilizers that we put in the ground can destroy nutrient contents. A study reported between 1958 and 1999 reports a decline of about 6 of the 13 nutrients that they were testing for during that time period. So we're losing our nutrient content of our food and also of our soil. I did want to mention for the water, some of the runoff issues. I don't know how many of you have seen King Corn. Okay, he did have a short follow-up video just on all the runoff that was coming from the water supply. And basically what they found was that they had to put in a nitrogen filtration system in Iowa because there was so much nitrogen inputs put into their farming practices, which was costing their community millions of dollars. It's the largest nitrogen filtration system in the entire world. And why they had to install it was because if they didn't, they were going to start having higher loss of children. Because during birthing practices, they weren't, sorry, I'm trying to remember all the details of it. Basically, the children weren't developing properly in the womb. Economic health. it's an important thing to keep when we're talking about sustainable foods is to always think about livable wages and what's being provided for both the farmer and the farm workers themselves. Farm workers often are low income and without insurance. I think statistically in California, it's about 80% of farm workers are without insurance. As far as farmers go, they're not really in a much better predicament themselves. The percentage of food dollar that actually goes to farmers has dropped dramatically over the last 20 years from about 30% to 19%. And farms have decreased largely in size. There really has been this momentum from the 1970s to really say get big or get out. And so small farms are having a really hard time adjusting in our society's current structure. As far as inputs and outputs go, inputs are just a fancy word for what we put into the ground to actually grow our crops, and outputs are the crop itself and what income it's bringing into a community. There's some really interesting research being done around this issue in the Midwest. And in Minnesota, they're looking at if communities change from conventional agricultural practices to sustainable agricultural practices, is it actually more beneficial for the communities themselves? A study that I saw while I was preparing for this interview said that in Michigan, if they started growing and eating more fruits and vegetables that were locally grown, if they just increased their consumption rates by 10 to 15% of local produce, that would bring in $400 million a year to the state of Michigan.
Years ago in the 70s, I worked at a friend's fruit farm. They had to ship all their fruit, their apples, to Washington State. And I would go into the local grocery store, and I was living in Michigan, the fruit capital of this United States, and all I could find were Washington apples. It was absolutely nuts. And the farmer, of course, has to pay for the shipping. So these poor farmers, the migrant workers that they had picking their fruit were making more money than the people, the farmers themselves.
I think that that's a common story no matter where you are. I mean, most of our produce that's actually grown in San Diego itself is shipped out. And particularly if it's processed, it's at least being shipped to LA and then back in San Diego. So I think it's been the massive numbers that they've been able to initially get it at a cheaper cost to ship it. I've heard some stories as crazy as like, you know, the fishing industry in Japan shipping it to Iceland to be processed and then sold back in Japan, but it was cheaper than having it processed in Japan. But that doesn't really state the real cost, the environmental impact, the impact of paying your workers low wages, and what that impact has on your health. So there's a lot of additional costs, but I think that a lot of communities are really looking like that because it's a very, very common practice.
Is there some way that, you know, through organizations like yours that individuals can get involved, community organizations that can help stop that practice, because it's, you know, it's nationwide, it's worldwide.
Absolutely. I think two things, and I'll kind of get into them a little bit further a little later, is one, vote with your dollar. Your dollar really does change things. The organic market has increased 20%, I think, on an annual basis. You just voting with your dollar, shopping at your farmer's market says there's more demand for these. To really advocating for change, one of the things that we're trying to create in San Diego County is a hub for aggregating, processing, and distributing local foods so we can more easily get them into our current system. Did you have that question?
I'm just kind of curious, you know, this is a presentation by the Childhood Obesity Initiative. I'm just wondering, how do you guys choose what you focus on? Because it seems like the presentation is covering, you know, a lot of different topics. I mean, certainly important topics, and they're all, you know, ultimately related. But like, how do you guys decide what to focus on in order to really affect something that's going to really benefit obese children?
Good question. I'll skip to the next. Okay. So why are we actually involved in this conversation at all? Like when I tell people that I'm starting to get more and more involved with local agriculture, I think most of them are just stumped. And it's been a learning curve, and we're still learning on a daily basis. But really, why we're involved is you've seen the supply and demand, what's currently available. We